you are going to increase deposits in your arteries, and you're going to form plaques. And the plaques, cholesterol-like plaques, are also going to narrow your arteries, thereby decreasing blood flow to everywhere, and also in particular to your penis. Welcome to Dayspring Life and Health channel. We are back on our series on ED, or erectile dysfunction, also known as impotence in men. All right, so today, if you haven't watched our first video on what erectile dysfunction is and the risk factors, you want to check up there on our channel and see and look for that video. So today we're going to talk about the causes of erectile dysfunction or impotence. I'm going to group them into major groups, and then after that I'll just list different examples of what causes erectile dysfunction. So it may be caused by either one or combination of the following. First one I'm going to talk about is a psychological cause of erectile dysfunction. By a psychological cause, I'm going to talk about how some people, by virtue of their psychological state, so mental health challenges, depression and anxiety, even the anxiety about sexual activity, the fear and the thought of not performing well itself can also lead to erectile dysfunction. Stress and also relationship problems. Sleep disorders can also cause erectile dysfunction. It's just a few people who get an erectile dysfunction from this cause. Moreover, most of the people who get erectile dysfunction from psychological cause can usually get it easily reversed as long as the problem they are dealing with mentally is removed. And the next group of causes I will group under the neurological causes, basically linked to your nerves and a few other things that go on in the body. Multiple sclerosis can also lead to erectile dysfunction. Parkinson's disease, another disease state that can also lead to erectile dysfunction. Diabetes can lead to nerve damage, and so prolonged high blood glucose levels can eventually lead to damage of your nerves. And if your nerves and neurons are damaged, they don't basically transmit information as well, and it can lead to neurological damage, which eventually leads to erectile dysfunction. Also, with that, if you have a major prostate surgery and major surgeries around the pelvic area, and the nerves are cut or are compromised during the prostate surgery, it can also lead to nerve damage, which eventually could lead to erectile dysfunctions. Let's move on. We're talking about hormonal issues too. Men with low testosterone can also have erectile dysfunction. And the other cause is the vascular cause, and which I think is the major cause of erectile dysfunction. Erection, as we told you about in the first video, is basically a system of blood flow to the penis, and anything that causes that flow to be inhibited or reduced or compromised definitely causes erectile dysfunction, either from atherosclerosis, buildup of plaques in your arteries, narrowing them to the point that blood flow to the penis is not as well as it should be. Heart disease, if you have heart disease or heart problems, you may also eventually have erectile dysfunction. Erectile dysfunction can also lead heart disease. So you may have erectile dysfunction before you have heart problems, because it usually starts first because of the fact that the arteries and the vessels in the penis are very small. They seem to be easily and earlier compromised than the major big arteries that go on the heart or around the heart. Erectile dysfunction itself is a sign of major heart problems to come in the future. But if you have heart problems, that can also lead to erectile dysfunction, because obviously you need your heart to pump the blood into your penis. The other thing is clogged vessels. Blood vessels are clogged due to cholesterol-like plaque material. Then we call it atherosclerosis. Then, of course, the blood flow is compromised, and that you can get blood into your penis where you need it to engorge and stuff like that. The other thing we mentioned earlier is high cholesterol, high blood pressure. We also mentioned that that's a major cause. It's a risk factor and a cause. If you're obese, that is also going to cause erectile dysfunction. Metabolic syndrome We mentioned diabetes and of course metabolic syndrome, a condition comprising of blood pressure, high insulin levels, body fat, high body fat around the waist, and also high cholesterol. Tobacco use, smoking, right? Smoking can cause erectile dysfunction by the same process like diabetes do. Smoking leads to plaque formation in your arteries, which do not only cause heart attacks and stuff in the future, but they start off as erectile dysfunction. There's another cause of erectile dysfunction called Peyronie's disease, which basically is a formation of scar tissue in the penis. So the accumulation of scar tissue in the penis obviously would resist any blood flow into the region of the penis where the scar is. Even if there's blood there, scar tissue does not blow up. It basically makes it stagnant or fixed over there. It can lead to pain and all those things, but eventually erectile dysfunction can be caused as a result of scar tissue. The other cause is the group that I put under medication use. Some medications are notorious for causing erectile dysfunction. I want to caution you, if you are on a medication for anything, you do not want to stop. As a matter of fact, even if your medicine is mentioned as one of those causes, there's a way to go about it. You don't stop medications because they may be the reason you are still around. So as a quick prelude, we know some of the beta blockers that are used to treat hypertension, heart failure, sometimes also used to treat migraine, even anxiety, palpitations, and there's also serotonin reuptake inhibitors. With these out of the way, you know the causes of erectile dysfunction. I'm pretty sure there are several other causes that time will not permit us to say, but this is a comprehensive list of causes. Beloved, I wish above all things that you prosper and be in health, even as your soul prospers.